We are going to get started. I'm hopeful that our other speaker, Ed, will join us very soon. So let's get started. We are excited to bring you this next session. Our patient subject matter experts often tell us that the opportunity to be with people who are likely to have a common purpose and likely to understand one another is very important to them. This is what the next session will explore. Next slide, please. All right, so we're going to take a look at the agenda for the session. We will soon have Ed Hickey, who is representing the American Association of Kidney Patients. Nancy Scott is with us, who is representing dialysis patient citizens. Curtis Warfield is representing Home Dialyzers United. And Janice Starling is the founder of All Kidney Patient Support Group. Our panelists will share their thoughts and experiences on the power of the patient voice, being an effective subject matter expert. If you have questions for any of the panelists, don't wait until the end of the conversation. Please submit your questions using the WebEx chat feature. So next slide. So we're going to learn a little bit more about the panelists. First, Ed is joining us. Ed is Vice President of the American Association of Kidney Patients. He is an attorney from Los Angeles. He served as an infantry officer in the United States Marine Corps as a lieutenant. His distinguished public service career includes posts on Capitol Hill as an administrative assistant, as a special assistant at the United States Department of Commerce, and following the terror attacks of September 11, 2001, as the senior advisor for Homeland Security for the director of the Office of Personnel Management under President George W. Bush. He is a recipient of a Silver Helmet Award from AMVET. Next slide. So we have Nancy Scott. Nancy is a retired nurse and an ordained minister. After retirement in 2001, Nancy had planned to travel the world. Unfortunately, in 2004, she underwent breast cancer and dialysis. After being on dialysis for 7 years, Nancy received a kidney transplant in 2011. In spite of her illness, she never stopped volunteering at Henrietta Johnson Medical Center, located in Delaware, and dialysis patient citizens located in Washington, D.C. And the next slide. Curtis Warfield is a senior quality analyst for the state of Indiana. In 2012, Curtis was diagnosed with stage 3 chronic kidney disease. In January of 2016, he received a kidney from a living donor, his daughter's sorority sister. Curtis has since given back to the community by bringing awareness to both kidney disease and the need for organ donors with a focus on people of color and low income. He volunteers with several organizations, including Home Dialyzers United, the National Kidney Foundation, and the Indiana Donor Network. And finally, Janice Starling is a native Floridian from St. Petersburg, where I am. We're right around the corner from each other, actually. In the year 2000, Janice was diagnosed with kidney failure. She has experience with in-center dialysis, peritoneal dialysis, and in-home hemodialysis. Janice received a kidney transplant on December 13th, 2013. Janice's lifetime goals consist of bringing about continued awareness, education, and advocacy about ESRD. So, our panelists, I would like you to tell us briefly about the organization you are representing today, and to give a brief understanding of the organization's mission. Let's start with Nancy.
I'm representing dialysis patient citizens located in Washington, D.C. We have over 28,000 members, and it's a patient-led organization. And the main mission is to, I'm going to give you the mission in the charter. DPC is a patient-led nonprofit organization dedicated to improving dialysis citizens' quality of life by advocating for favorable public policy. When I think of DPC, I think of it as a lifesaver. And as I said, I recommend that everybody join DPC. Not only do we have the advocacy side, but we have the education side as well. Thank you.
And you're welcome. And Curtis?
Hi, I'm Curtis Warfield. I'm here with Home Dialysis United. We're a small 501c3 not-for-profit group that specializes in home dialysis, both peritoneal and hemodialysis. And we're here to basically inspire people, to inform people that they can live and live an active life even though they're on dialysis. And our mission and vision includes to have strategies addressed with inconsistencies of dialysis treatment and to associate those problems with home dialysis treatments.
Thank you, Curtis. Janice.
Hi, so happy to be here. My organization is All Kidney Patient Support Group. We call it AKPSG. It's a nonprofit organization established in 2009. We're a group of patients with different stages of CKD and ESRD with past and current lifestyles. We inform others on how to live a quality life. We know what it's like to experience dialysis and on all levels. And so we also identify with doing dialysis at home in both peritoneal, home hemo, and in center. We understand the process to prepare for transplantation and maintaining being on the transplant list. Our mission statement for All Kidney Patient Support Group. All Kidney Patient Support Group is a patient-centered peer organization that provides non-medical support to those in need and affected by chronic kidney disease, end-stage renal disease, and all other diseases that may lead to CKD or ESRD.
All right. So, Curtis, can you give me your definition of what a patient advocate is?
To me, a patient advocate is kind of the middleman. He is a person who goes out to our medical organizations and asks the questions of why things are going on and is able to bring that back to our patients and our fellow patients and give those answers, and then just relay the messages if you're having issues with dialysis and why you're doing one dialysis and may not be doing the other. Just real quickly, for me, when I hit that stage of dialysis, I did not know the difference between hemodialysis, never heard of peritoneal. So I've been able to help people understand that and give them more options than what they have in the past.
Nancy, what about you? What's your definition of a patient advocate?
When I think of a patient advocate, I think of a communicator and a person that is working on behalf of other patients to ensure that they have quality of life, better policies. I also think of the quote, and I use it often, by Martin Luther King. Our lives begin to end when we are silent about the things that matter. And a patient advocate is never silent and definitely a communicator. Thank you.
Janice?
I also, too, believe that a patient advocate is a person that speaks up for someone who doesn't have a voice. Some patients not able to express how they feel. They're not able to express what's going on in the center. They're not able to express concerns about the different dialyses or don't know how to. And a patient advocate is a voice for those who cannot speak. A patient advocate is, like Nancy said, someone who speaks and communicates on the behalf of others.
All right.
With action.
So,
with action.
Awesome. Hey, Matt, I understand that Ed Hickey has joined the call. Just want to be sure that we have him up in the panelist section.
Hey, Jerome, I'm looking for him now. I do not see the name, though, so I'm not sure if it's a call-in or...
All right. All right. We'll try to figure that out and continue the conversation. Sorry. So, Janice, can you give the audience a couple of examples of how advocacy, either self-advocacy or advocacy for your organization, has impacted your life or the life of someone you know?
Yes, Jerome, I'm glad you asked that question about self-advocacy or our organization. First of all, I just like to say that I have participated in each one of these organizations, and each one of them has given me the voice to speak up for others. We had a patient, a married couple that was attending our support group meetings for support. And in the process, the husband was having a hard time on dialysis. And he just couldn't get it. He just, he was just having a difficult time. Well, in the process of attending our meetings, he learned about, him and his wife learned about organ donations, about LifeLink. And so his wife said, well, I'm going to go get tested to give my husband and see if I'm a match. Well, during that process, we helped her learn the process of organ donation. And she went through the process and found out that she was a match. So what All Kidney Patient Support Group did, we rallied together and helped them raise the funds that they needed. We helped them do events. We put them out on Facebook. We did all type of fundraisers. And on June of last year, Wally and Terry, she gave her kidney to her husband. And he has a transplant. It's already been a year, and they're going on their second year. And not only that, not just giving them the opportunity for transplantation, but we also gave Terry opportunity to find a job. We gave her a job. We gave her education. She now works at our child care center, and she's a teacher and a cook at our local daycare center. So not only just educating them about kidney and transplantation, and now Wally has a transplant and they're living a great life, but also was able to help them financially with a job and giving them the right directions and about insurance and all of that information. So all of that came through All Kidney Patient Support Group, where we advocated for them to raise the funds that they needed for LifeLink, to get the transplant. And we raised the funds for them to be able to sustain the kidney. We gave them information about Wally was having trouble with his medication. So I was able to tap into Joe at the National Kidney Foundation, and he was able to get his medication paid for. So it was a different, advocacy before the transplant, during the transplant, and now after the transplant.
Wow, awesome. That's awesome. And I'm sure both husband and wife are very thankful for the help that they received through a local support group, because your organization is a local support group.
Yes, we are a local support group that started from 3 patients attending the American Association of Kidney Patients, being involved with dialysis patient citizens. Once I got on home hemodialysis, I was a part of home dialyzers. So from all 3 of those organizations and learning how to advocate, we was able to come back home and start our own local support group. And now we do, well, I get into later different things that we do, but yes, it is a local support group by patients, for patients, and we do our own fundraisers.
Awesome. Curtis, what about you? Can you provide an example of either self-advocacy or advocating for someone else?
There have been a few. One in particular that I think of is a friend of mine from church who had found out that he was diagnosed with kidney disease and just was really at a loss as to what to do. All he knew was that he was starting dialysis, and by what his friends were telling him, his lifespan was not going to be long. And so when contacting me, I kind of let him know that things were going to be all right. Look at me as an example. I was able to supply him with some information as far as what happens when you are at end-stage renal disease and what goes on from there, that you have choices to make, that you can still live a life, that there is a thing called transplant that you can look at as a probably the best treatment for the condition that he was in at the time. So he was able to it lifted his spirits. I was able to kind of help him move through that. He's doing very well now. He's on dialysis. He's on the transplant waiting list. He's seeking a living donor now through programs like the Big Ask, Big Give. And it's been a big help. And having an organization like Home Dialysis has also been a big help with their website and informational page that we have out there. And then another quick example has been being able to go and advocate on Capitol Hill. And our recent passment, I should say, of the bill for immunosuppressant drugs, which for people who may not have known, once you get a kidney transplant, Medicare only supplies you 36 months past your transplant with helping pay for those drugs. Now, it would start in 2023. People who don't qualify for Medicare based on their age and don't have any type of insurance will now have their drug coverage totally covered from the time they receive that transplant until the time they actually do qualify for Medicare.
Thank you, Curtis, for that, and thank you for all the work that you are doing. Let's ask Nancy the same question.
Yes, I think before you help anybody else, you have to help yourself.
Amen.
And when I started with dialysis, I was a babbling idiot. I knew nothing. I was crying all the time, sad, thought my life had ended. And I knew that I had to come up with something or I wasn't going to be on the planet that much longer. So I learned to self-educate, everything. I cannulated myself.
Yes.
And then I found out about dialysis patient citizens, and they literally saved my life. I got involved and realized how much the government had an impact on policies for sick people. I went from a babbling patient to being able to speak in front of the President of the United States in 2019, and I was able to be there when he signed the executive orders. And I'm sure all of you are aware of the executive orders that were signed. So it just goes to show you that joining an organization can really help you, but you have to make sure that you find the right organization. And I believe that I found the right organization with dialysis patient citizens. Thank you.
Thank you, Nancy. And again, thank you as well for all of the work that you're doing for fellow patients out there. I believe we have Mr. Ed Hickey on the phone with us. Ed, can you hear me?
I can very well. I've actually had the opportunity to listen since the beginning. Been speaking to myself though, so it's good to be here today.
Awesome. Thank you for joining us. Can you give us a brief understanding of the organization that you're representing today and the organization's mission?
Sure. And thanks for having me today. AAKP, the American Association of Kidney Patients, was founded in 1969, and we're the oldest and largest independent kidney patient organization in the United States. We're dedicated to improving the lives and long-term outcomes of kidney patients through education, advocacy, patient engagement, and the fostering of patient communities. We fight for early disease detection and the appropriate diagnosis of rare and genetic conditions, increased kidney transplantation, and preemptive transplantation, full patient choice of either in-center or home dialysis, protection of the patient-physician relationship, promotion of research and innovation, including artificial, implantable, and wearable kidneys, and the elimination of barriers for patient access to treatment options.
So, Ed, one of the questions that I asked the panelists is, can you give the audience an example of how advocacy, either self-advocacy or advocacy for the organization that you are a part of, impacted your life or the life of someone you know?
Sure. Actually, I can give a broader example than that in the lives of people who are considering a transplant. Most people are aware that under Medicare, the autoimmune suppressive drugs were available for 3 years. And then after that, you had to pay for the drugs out of your own pocket. And a lot of people who were considering transplants had to make a decision about whether they'd be able to cover the cost of the drugs after 3 years, or whether they just stay on dialysis for the rest of their lives. And at AAKP, we believe that every kidney patient should be able to live as a life that isn't hindered by their disease, and to the extent possible, be contributing members of society. So we have worked with Congress for almost a decade to get the artificial 3-year limitation on the subsidy for the drugs lifted, so that more people would get the kidney transplants and not opt for dialysis, and then move on to fully functioning life. And in the most recent budget reconciliation in Congress and working with Congress and the White House, we were able to have included in the final budget bill for 2020 that was passed in December, language that lifted the 3-year restriction. And we did that through an assessment with the Congressional Budget Office, which changed the calculation on the cost of the drug to look at what the kidney patient would be contributing after they made the decision to have an implant or transplant instead of remaining on dialysis for the rest of their life. And as a result of our efforts with the Congressional Budget Office and with the Congress, it was determined that it would actually have a positive impact on the budget by encouraging transplants. And so now kidney patients aren't faced with an artificial deadline or barrier to their transplantation choice, and they're free to make the decision without the encumbrance of the federal government. So it's a pretty it was a broad impact that we had, but it was very important and something we worked on for more than a decade.
It's amazing what patients are doing in our kidney community, not only locally but nationally. You're making huge changes and lives across this country. I want to go back to Curtis. Why did you decide to get involved in the organizations that you are involved in, particularly HDU?
I got involved with HDU basically on my past history. I was diagnosed in 2012 at stage 3 kidney disease, and my clinic at the time believed that you had to go through all 3 of the steps. Once you're diagnosed, you go to ESRD, you go to dialysis, and then you're placed on the waiting list, which is a whole nother discussion. But as I was going through the dialysis phase, as I had mentioned before, all they talked about was hemodialysis and at an in-center clinic. And that wasn't going to work for me. I worked full-time. 2 of my 4 kids were still at home at the time, so I was kind of the main provider monetarily wise. And it wasn't until I went through 2 failed fistula attempts that I found out from somebody else that, oh, there's another type of dialysis called peritoneal. And it's a lot easier it probably will be a lot easier for you. And it makes you a little more flexible in my case. So not having to hear that from my clinic or from my nephrologist at the time, it upset me, and I didn't want anybody else to go through things like that. I wanted them to be fully informed as they go through the steps of having kidney disease and as their kidneys are failing. So home dialysis really provides a lot of good information about doing home dialysis, either hemo or peritoneal. And it gives me fulfillment in helping other people and having a good organization behind me with good information that I can relay them to. So it's all about helping my fellow person.
Thank you. Nancy, same question to you. Why did you decide to get involved in DPC?
Well, actually, it wasn't my decision. My nurse practitioner who would visit every Friday said, Nancy, you've been, asking questions, self-cannulating, getting a rein on this disease. I ran into some people that have an organization in DC and they go on Capitol Hill, and I think something that would help you a lot. So I called DPC, and the CEO at that time said, tell me a little bit about yourself and blah, blah, blah. So I said, I told him, what I did and how I got started and the whole 9 yards. And he said, listen, can you go to Pittsburgh for me and speak to a group of ESRD networks? I said, well, I don't know anything about the organization yet. He said, oh, you will know. He said, you're officially a DPC member and you're going to represent us in Pittsburgh. So that was in 2007. And I did not, I stayed with DPC, of course, until the end of last year. And I had served as, I guess, every office that they had. I was president of the advocacy side. And when you get a transplant, you must be on dialysis to be president of the advocacy side. And then I helped to launch the education center about 7 years ago. So I decided that I had to make room for somebody else. And I'll talk more about what I'm doing with DPC when we talk about the support group. Okay. Thank you again.
Okay. No problem. And Janice, why did you decide to organize a local support group?
First, I was just like Nancy. My social worker said, hey, I have this support group organization, and it was Dialysis Patient Citizens. And I started with Dialysis Patient Citizen, and I started with the network, the local network 7. And I started educating myself, and dialysis patient citizen, me and Nancy worked together, and as far as education, they taught me everything about World Kidney Day. They advised me, go home and do a World Kidney Day event. And that's how I got started, by doing World Kidney Day locally. From everything that I learned from dialysis patient citizens, I came home and started doing it locally. And from there, tapping into the network, when I remember Helen Rose and all of the people at the network would come and speak at our World Kidney Day event. And from there, the people, that started in 2009 and 10. And from all of the people that were attending the event, I saw like-minded people, and that's how we started All Kidney Patient Support Group. And AAKP was another organization that I got involved with. They helped me. They're right here in Tampa, St. Pete area, and they also educated me at their annual conferences. I would go every year, and through education of myself, and I would always say, come and go with me, or hey, are you going to sign up to go? And it would be 3 and 2 and maybe 4 people would go with me and my husband, and we would go and we would learn, and me and my husband would go to DCP and do Capitol Hill, and we learned so much. And then the National Association of Nephrologists, we went and I spoke with them, and also Baxter, all of the education from Baxter. So from all of the education that I received from different national organizations, it was like people at my home center did not know about dialysis patient citizens. They did not know about AAKP. They did not know about the local network. They did not know about self-cannulation, as you were saying. They did not know about peritoneal home hemodialysis. They did not know about any of these things. And luckily, when I was first introduced to dialysis, my doctor said, you'll be a good candidate for peritoneal. So from peritoneal dialysis and having that freedom of lifestyle for my first choice of dialysis, I went to Alaska with peritoneal dialysis with my machine and on a cruise ship. And when I tell people those things, they're like, wow, you did that? I went to Vegas on doing dialysis and just traveling and going to the centers. So you can have a life with dialysis, and I wanted people to have that opportunity to have a life. So that's how we started All Kidney Patient Support Group. We wanted to include all CKD, ESRD. We wanted to include high blood pressure, hypertension, diabetes patient, all kidneys, whatever it was. And that's how we came up with the name All Kidney Patient Support Group. So it incorporates everybody, every organization, and we use every organization education to educate people locally so that they can have a great quality of life.
Thank you. Ed, I know AAKP has been doing a lot of work for patients since COVID started. Can you talk about the organization's biggest accomplishments over the last year in supporting people with kidney disease during the pandemic?
Sure. So we work very closely with the FDA, with the CDC, and all HHS, all the federal agencies that have responsibility for implementing the guidelines for the population as a whole, but specifically educating them on how kidney patients are impacted by COVID. We've had a number of webinars with representatives from the government. Within AAKP, I'm also chair of the Veterans Health Initiative, and we've had people from the Veterans Administration talk about their own separate COVID programs that they have with veterans within their system. But we have available on our our website, some of the through the Center for Patient Engagement and Advocacy, some of the events that we've put on, and they've been very successful and very well received. But I think, pardon me, I think advocating at the federal level with the CDC and the FDA, and then translating that to webinars with the decision makers really contributes to the general health and well-being of kidney patients.
Curtis, Nancy, Janice, what about you guys? Have your organizations done any work to support patients during the pandemic?
You want to go in order? You said Curtis, Nancy, and Janice. So
let's start with Curtis.
Yes, through our website, we have lots of information about COVID-19 and getting the vaccine, along with resource materials that you can go to, and other websites that you can get information from, such as AAKP and NKF, and just getting the word out there about right now why you should get a vaccination. So we do have lots of information out there, and just trying to disseminate it to as many people as possible.
I would say dialysis patient citizen is the same. As you know, I'm not on the board anymore, but I do keep up as a patient ambassador. And the websites for DPC are phenomenal. I mean, they actually have classrooms. The minute we have also the e-news, and we also have the Kidney Citizen, which is more, I call it a magazine, really, because that's what it looks like. So the minute that the pandemic set in, our director of education immediately got together materials. And as I said, you can always refer to our website. So I think that would be the best tool to use if you wanted to find out something about the pandemic on our website. Thank you.
Okay, here locally, what we've done, well, since last year was the pandemic, was March, we were supposed to go and speak in Orlando, but to a local college of early dialysis techs, and kind of let them be aware of what dialysis was and what it was sitting in the chair, but that got all canceled because of COVID. So we worked along with a local Daystar organization here locally in St. Petersburg, and we started giving out kidney-friendly food to all of the dialysis patients who signed up. So once a month, and we still do, since COVID-19, every month, and we have fed at least 100 people each month, families, with kidney-friendly food, strawberries, blueberries, chicken. In December, we received a grant to help supply, to buy even more food. We purchased salmon and lamb and chicken, and we give out boxes to each family in the community. Not only just kidney patients, I sent a letter to the dialysis patients, to the dialysis social worker, and the patients call and sign up, and we give out they come in, they drive through, and we give out food boxes. But in December, we served over 1,500 families here in St. Petersburg, people with dialysis, on dialysis, transplantation, people with hypertension, diabetes, or any other disease that cause kidney disease. And we fed the families. And when I heard one lady call, she said, "I've never had Brussels sprouts before. I didn't know what to do with Brussels sprouts. I didn't know what they were." So inside the box, we gave them recipes, kidney-friendly recipes. And she said, and it was good. I enjoy Brussels sprouts now. And so it was the opportunity. One lady didn't even know what to do. It's amazing. She didn't even know what to do with olive oil. never experienced olive oil. And she said, well, what do I do with it? How do I cook with it? So, I mean, that just goes to show you different people are on different levels. And when you're talking about kidney friendly or healthy food, when she didn't know what to do with olive oil, Brussels sprouts, one lady said, how do I cook the lamb? So we put a lamb recipe, and on Facebook, she said, I treated myself to buy me a smokeless grill. So she posted on Facebook pictures of her lamb, and we gave out the rosemary and the garlic to go with the lamb and the olive oil. Just, we had to give them the food so they could eat healthy, and the ingredients in the recipe. So that was amazing to be able to do that during COVID. Ever since March of last year, we've been giving out food boxes, and we still
That's
continue to
awesome.
do it. Yes.
That's really awesome that a local support group is able to make that happen. We did get a comment in the chat from someone. She said, I teach my patient peers that being your own advocate means being an active participant in your diagnosis and treatment plan. Advocating for yourself means being willing to do research, ask questions, and rock the boat if necessary. So if anyone in our audience has questions for the panelists, please send your questions through the WebEx chat feature. Let's see, we are getting a couple of another comments, but this one came in. What advice would you give someone who wants to get involved with being a dialysis facility representative, start a support group, or become involved in a national group like the ESRD network program or national patient group? Ed, let's start with you.
So you can, I would visit the AAKP website and sign up as a member. Membership is free. There's a special membership link in the second bar down. There's educational information. I agree completely with the previous comment about being your own advocate and educating yourself and taking advantage of all of the resources that everyone on this panel has to offer and in their organizations. Through AAKP, we have an ambassador program, which allows people to go out to their regions and educate folks, have seminars, have meetings, have group discussions about their treatment and issues that they're encountering, and it also offers opportunities to go to Capitol Hill to talk to the representatives about specific legislative issues that are inhibiting the care of kidney patients or issues that can advance the care of kidney patients. So big picture, we can help with the legislation. Small picture, we can help in the local communities, get people together and help people get educated about what we as kidney patients encounter.
All right. Curtis.
I would say definitely check out some of the websites of some of the organizations and make contacts with people there. You can contact us at homedialyzerunited.org, but also educate yourself. The big thing with being an advocate is to educate yourself so that you can give information back to your fellow peers. And that way you're keeping up with what's going on. You're not giving out false information, and you're just really able to help other people as you keep up with what's going on in this CKD community.
So, Janice, you mentioned the ESRD Network 7.
Yes.
And that you were involved in that. Can you share with the audience of about how someone can get involved with either their ESRD network or the ESRD NCC?
Well, first,
Janice,
yes. If you go to the Kidney Hub, I think it's kidneyhub.org. I think that is the correct, am I right? I think it's Kidney Hub. I think that's the website. But
the ESRDNCC.org?
Yes, ESE, yes.
ESRDNCC.org.
Yes. Okay, well, from there, what I've done is, like he said, like Curtis said, you don't want to give out any wrong information. And they have the latest information and flyers that are done by patients that are everything that you need to know about kidney disease, that you need to know about in-center, that you need to know about peritoneal. So I go to the website, and also DPC has a great website also for education. But that's the way that I learned to locally get involved with your ESRD network. And when I had events, they would also come and speak, give me the flyer, give me the information to make sure that I was giving out correct information. So if you go on the website and sign up and attend the PAC, there is a PAC committee. You can sign up to get on the PAC. You can sign up to be a part and get involved.
Yeah, which is the Patient Advisory Committee.
The Patient Advisory Committee. You can sign up, and that way, where you listen to other patients, just like we're doing now, you listen and you learn, and from listening and educating yourself, then you become the patient advocate, and then you start speaking and going out.
Yeah, and for those of you that are on dialysis, if you speak with your social worker at the dialysis center and let them know that you want to become more involved, you can become a facility representative or ask them to tell you more information about the ESRD network program. And so your social worker can direct you to the network that's for your area. We got a question in from the audience. I will start with Curtis. What other changes have you had to make because of COVID? What kinds of changes has HTU had to make because of COVID?
We haven't been able to get out into our different communities. We are kind of broad-based in that we're located across the country. So the big thing is not being able to get out into the communities and speak on home dialysis and reasons that you can use it and what dialysis is all about. So a lot of, a lot of our things have been done through our website and through our Facebook page. So it's been a little confining. So we're hoping things will get better soon so we can get out and speak to the community face to face again.
Okay. And Ed, has AAKP had to make some big changes in its efforts to reach patients?
Well, in a sense, we're based in Florida, so it's a little bit easier for people to come and go there than it is in other parts of the country. I'm in California, where our movements are pretty restricted, but through the webinars we've been offering, I think we've been able to reach people pretty effectively. It's something that we have to overcome, and we had to cancel our annual meeting and likely this year as well, just because of the travel restrictions, particularly for kidney patients before the vaccine is administered. But we've really made an effort to ramp up our education programs because of this and understand the importance of health and reaching out to the communities that we serve to make sure that they have the adequate information. But it's inhibited our ability to immediately reach people. That's for sure. But again, I would encourage people to go to our webpage and check out the coronavirus information that we have at the top of our page. There's a big red button that opens up to all sorts of resources.
Thank you, Ed. Nancy, can you talk about any of the changes that DPC has had to have changed since COVID?
Jerome, if this had happened 50 years ago, I think we'd all have a problem. Because of technology, it has made us be creative. And DPC has always had a patient ambassador call per month, as well as an education call per month. So we're still very much reaching our patients. We have, as I said, our Kidney Citizen, we have our e-news. So it hasn't really stopped us, and we're also known for having fly-ins where we fly people in from every state, and we would go to Capitol Hill. Well, 2020 we had a virtual fly-in. So you have to be very creative, and you can still get the message out. And I always say, thank goodness for modern technology.
Yes.
Yeah. Janice, we did get one more question regarding your idea to support the community with food. So the question is, how did you come up with the idea to support your community with food? It's different than education support.
Well, we work along with we was having our meeting at Daystar Life Center, which is a food distribution for homeless and veterans and anybody in the area right now who are having low income. So that's where we were having our meeting. They built a new location, which is like right down the street from me. And I looked at the building and I said, I want to be in that building. And I prayed, and just so happened the young lady that's over the administrator, she and I have the same personalities. We have the same willing to help everybody. And she knew about kidney disease, but she didn't know about kidney disease. She just knew somebody in her family had it. So by us having our meeting, she would sit in, the executive director, and she would sit in, and she learned so much from our meetings. We started in June before COVID. So when COVID came about, she was like, so we wasn't able to have our monthly meetings. So we had our meeting in February, but we couldn't have our meeting in March. She said, well, let's try doing food distributions. And I said, the only thing with food distributions, when you're thinking about giving out to kidney patients, it's certain things that we can't have. We can't have high phosphorus food. We can't have a lot of bread and a lot of this and a lot of that. So I said, well, it has to be a kidney-friendly diet. So she agreed to do the kidney-friendly diet. And from there, with she and I talking, we formulated, and from the NCC network, oh my goodness, you gave out a kidney-friendly diet grocery list. So I was able to go and click on that, print that out, and give her an example of the grocery list and the type of food that a kidney-friendly diet a person's supposed to have. So that list, Jerome, I use that list all the time. And I take that list and I say, hey, we can't have, it was like, well, most people say, well, we got to have bananas. We could do oranges. And I'm like, no. And it specifically says mandarins or tangerines. So we cater the food specifically for people with kidney disease. So which is help. And I've had one person say that because I've been eating your food for a month, my A1C came down. And the blueberries and the strawberries, and they've been eating healthy, and the chicken, skinless chicken breast. And she said my A1C came down when I went to the doctor. So I was like, whoa, that's awesome. So we're not just dealing with kidney patients, we're dealing with diabetes patients and high blood pressure patients, no canned food with all of the sodium. So that's how we was able to cater it from the list that I got from the NCC that you had on the website, to take this and hand it to them and say, this is a kidney-friendly diet.
Well, thank you, Janice. I want to thank all of our speakers today. Thank you for your time. Thank you for sharing of yourself and your experiences. We really appreciate you being with us. Thank you, guys.
Thank you.
Thank you for the opportunity.
You're welcome.
So, want to tell you about some additional ESRD NCC resources that are online, our COVID resources. This one is tips to help you boost your physical and mental health during COVID-19. Again, this is another resource developed by patients for patients. It offers practical tips to help you deal better with stress and anxiety, and you can download this resource at kidneycovidinfocenter.com. Just click on the For Patients button. And next slide, please. Another online resource. So this is for family member resources. You can get information about what to expect as a newly diagnosed patient, understanding the grievance process, choosing transplantation, choosing home dialysis, emergency planning, and caregiving. We also have links to trustworthy organizations, some of which we talked about today. So to get this information, visit the ESRDNCC.org website and click on the patient icon. We are going to take a little break, about a 4-minute break, and we will get started with our next session at about 3 o'clock. So just a few minutes, we'll get started.